So before I begin my procedure, I'm going to do a full respiratory assessment. I'm going to take my patient's vital signs. He's got vitals, his temperature is 98.4, his BP is 120/72, pulse 76, his respirations are 30, which is high, and he has an O2 sat of 94 on humidified air, and he is having a non-productive cough. I asked him if he has any pain, and he states he's having no pain at this time. I'm observing my patient for signs of hypoxia. I'm also noticing that he's labored and he's breathing. I'm going to do a full respiratory assessment, front and back, listen for lung sounds, and for any congestion. I'm just going to have you take in deep, breathe in and out slowly and as deep as you can. I'm going to be listening in the front. I'm also going to be listening to my patient's lungs in the back. I'm going to have him sitting up. I'm also going to be listening bilaterally for lung sounds. And he's labored and he's breathing. I do hear some crackles. I think that it's indicated that he needs to be suctioned. So the first thing that I'm going to do is make sure that my patient is hyperoxygenated before I begin the procedure.
So first off, I would come there, set the patient, twice,
I'm going to explain to my patient that I'm going to be doing his trach suctioning.
I would explain to the patient how long talk to the
On a clean table, I have my supplies arranged.
And as always, provide safety.
My patient is safe. He understands what I'm doing. I'm placing a drape over his chest. I'm going to be putting on protective goggles and a protective gown. On a clean surface, I'm going to prepare my supplies. I've already made sure that the tubing for the suctioning on the wall is connected. I'm going to turn it on to 120, make sure that it works.
And I would definitely perform
Again, the table is clean. I'm going to now open my sterile
Do you have your
trach suctioning kit.
No, did you just stop it?
I just said stop.
Alright, I'll just start it again.
Okay. Yeah, you're doing it. I just said stop it.
Making sure that the expiration date on my saline is not expired and that I'm going to lip the bottle if it's not a new bottle before I pour a little bit of saline into the cup.
Yep. Okay.
I'm now going to don sterile
I'll do a
gloves.
complete cardiopulmonary assessment. Listen to lung sounds from the back. Since our patient is unconscious, I will get like an assistant or something on the wall, decide to back or lift up the end of the bed, move forward, and listen from there. But since we don't, I'll just start right now with the front. Listen to lung sounds. Start at the top.
Alright, now with my sterile hand, I'm going to take the trach suction tube out slowly, making sure that I don't touch the sterile end. My hands are still sterile. Making sure that I'm not touching this tip to anything dirty. And I'm going to now connect the suction tubing to the suction on the wall. I'm going to turn on my machine. This hand is now dirty. I'm going to turn on the machine and check to make sure my suction's working and it's working properly. This is still a clean, sterile tip. I'm letting my patient know that I'm going to be suctioning, and I'm going to encourage coughing if the patient feels the need. Without suctioning, I'm going to enter tracheostomy and insert it until I feel some resistance without suctioning. And then I'm going to pull back just about a centimeter, and in a circular motion, I'm going to be suctioning as I come out. I'm going to do it once more, circulating the entire circumference of the tube to make sure that I get any of the blockage that's in the way. And then just going to flush this tube with a little bit of water, saline.
So,
I'm going to move my gloves, turn off the machine.
comfortable position, perform hip hygiene.